Hello again, here we are, your pet, your vet. Today's show I think you'll really enjoy. It involves a dog named Ruger. Ruger is about 2 years of age, I think even less, 1 year of age. And she has a medical condition that's quite common in dogs called hip dysplasia. We're going to show you the x-rays, and we're also going to show you a complementary medical care that can be used to help treat the pain, known as acupuncture. So we'll talk about that today. But I want you to meet Ruger and Kristen. They're right over here, and I want you to appreciate Ruger's lameness. Kristen, would you walk Ruger toward us? Come on, Ruger. If you watch Ruger walk by, you'll see on his left rear leg, he doesn't place it down. You see that? And I think you can appreciate that lameness. Well, we had to take radiographs, which I'll show you next, that gave us the diagnosis. Okay, we're going to go inside now and I'll show you the radiographs. Okay, here we are in the radiology room. These are Ruger's radiographs or x-rays. Remember, he's a black mouth cur, which is a shepherd cross type breed. And this is the x-rays that told us what was wrong. If you look at Ruger's hips, this is his right hip, and you notice the hip ball or ball part of the femur is nice and tucked in good into the socket or acetabulum. On the left leg, you'll notice, particularly compared to the right, there's a subluxation of the hip. It's not really completely out of the socket, but this causes great pain because you have the actual bone rubbing on the cartilage, and that's really painful. We have tried several conventional ways of treating this on Ruger, and it really hasn't been enough to alleviate that pain. We're going to provide acupuncture today to help Ruger because he is going to have a surgical procedure next week called a femoral head and neck osteectomy, where we're actually going to remove the femoral head and neck, and this is going to remove that abnormal cartilage on bone contact, and because that's the source of the pain. And this is a very effective way to treat this condition. If you can't control it medically, that's my motto, surgery should be a last resort. But in this case, Ruger is going to have surgery, but in the meantime, we're going to try to keep him comfortable because pain is a real problem with Ruger. Okay, here we are with Ruger again, and this is Dr. Rende Barrett. Dr. Barrett is certified in International Veterinary Acupuncture Society. It's a very unique distinction. She had to do some extra education. It's about a 2-year program, and she's certified to provide veterinary acupuncture and is working on her certification for holistic herbal medicine too. This is Kristen again, and this, of course, is our patient Ruger. Remember, we talked about we're going to have to do surgery on Ruger, but in the meantime, the conventional treatments are not sufficient to control the pain issues he's having. So Kristen has been concerned about that, and she has requested acupuncture. So Dr. Barrett, if you would explain to the audience what you'll be doing to provide acupuncture.
So I'm going to be putting some needles along Ruger's spine and also around his left hip, which is the hip that's most affected with arthritis, to kind of help with just some localized inflammation and pain. So, hey baby.
So I guess in acupuncture, I'm a little bit of an older veterinarian, so acupuncture is relatively new to me too. But I can tell you, I've been amazed with the success. It has been used quite a bit. Traditionally, I think it's more known for pain management protocols, even in human medicine. But as Dr. Barrett has taught me, there are many medical conditions, if not any medical condition, that can have acupuncture application. Isn't that right?
Yes. Anything basically can be treated with medicine, can be treated with acupuncture.
Right. It's the oldest, one of the oldest treatment modalities known to man.
Yes, thousands of years old.
Yeah, it's amazing. So you can see how these needles are going in, and Ruger doesn't even know what's going on. But it stimulates and basically creates, I don't think we totally know what's going on, but it creates some, I think helps with some endorphins. Endorphin release, which is helps with pain management. And then there's meridians and it's pathways that have been learned over the centuries that have shown to help people, and fortunately we're able to apply the same knowledge to pets. And the reason why I say I want to point out how impressive this treatment modality is, one of my first experiences with it was when I had a kitty cat here that had a respiratory tract condition and was really doing fine, but I couldn't get this kitty cat to eat. After about 2 or 3 days, I was getting really concerned. So I asked Dr. Barrett if she had an acupuncture treatment protocol just for anorexia or poor appetite. And lo and behold, she treated that little kitten, and within 5 minutes it started eating. So that made a believer out of me. So we wanted to show you that acupuncture is available at Lake Chatuge Animal Hospital and also Tri-County Animal Clinic. Dr. Barrett works at both sites, even makes house calls from time to time, so when it's appropriate. And as you can see, she's treating Ruger here, and I know I have a theory about needles. It's better to give than receive, but you can tell about Ruger. He's doing really great.
He is. He's great. He's a
That's
great
remarkable.
patient.
A really sweet dog. So how long do you typically have to leave the needles in?
I typically leave them in 10 to 15 minutes.
10 to 15 minutes. Well, we don't have that much time on the TV show, but I think you get the idea. There's a certain protocol that can be used, and I can almost guarantee you that Ruger is going to have some benefit. But like we mentioned before, he has a problem that's going to require surgery to have the best outcome as far as long term. So again, thank you very much for being with us today on Your Pet, Your Vet, and please contact us if you have any questions about acupuncture in particular or any areas of health care for your pets.